All right, so we're going to talk about how we treat shin splints or tibia stress syndrome. So our first go-to when we have somebody walk in with shin splints is we like to dry needle. Yeah, it sounds very painful, but it increases that healing response. Essentially, a shin splint is tiny little stress fractures of that shin or of the muscle pulling at that shin. And so if we can needle it, we increase blood flow, increase a positive inflammatory response so that things heal quicker. The next thing that we're looking at is range of motion. We're chiropractors, so we like to adjust things or do mobility with certain joints. So we look above and below. So we're specifically looking at the foot and the ankle, making sure that our foot has the proper motion. There's 33 joints in the foot, and so we want to make sure all those joints are working correctly. We want to make sure that the ankle has adequate range of motion. Then we even look at the knee. There's a little bit of rotation. We want to make sure that that knee is rotating to take some of that stress off that shin. Then we also go up into the hip. Our hips need to rotate when we are stepping or running, just getting a little bit of rotation, but they also have to extend and come up into flexion. So we have to make sure all those joints are doing the right things so that we can lessen the stress on the shins. After that, we want to rehab. So we are going after our foot intrinsic muscles. So our tiny little muscles inside of the foot. We like to use a little pad in here. We call it the toe pro. But essentially, we're just going after calf raises. We want to make sure that those calves and the toe muscles integrate and get enough strength to control that foot and to control the ankle and our knee. And so that's our go-to exercise. We also go after hip stability. If we don't have good hip stability, our lower leg can basically go all over the place. We need to make sure that our hip is controlled and it is stable so that we aren't putting so much stress through that tibia. And the last thing that we really look at is gait and footwear modifications. So seeing if we need to change how we're striking our feet or seeing if we need to change the shoes that we're wearing. Sometimes it can be as easy as that. And sometimes the shoe choices that we use have a big impact on how our foot is being loaded and how much stress is actually going through the tibia.